Welcome back. So today we're diving into the 2026 Super Bowl, but not the game itself.
Not the touchdowns, no. We were talking about the ads. It was basically the health Super Bowl, wasn't it?
It really was. You had Pfizer, Novartis, hims and hers everywhere. And a lot of controversy, too.
Oh, yeah. That hints out on drug pricing, the Novartis tight end spot. But behind all that, the real story is the technology they're all circling.
Exactly. And that's our mission today, to unpack the Galeri blood test. It's this idea of a single blood draw that can screen for, what, over 50 cancers?
50, yeah. But it costs about $1,000, and insurance doesn't touch it.
So the big question is it a life-saving bargain or just a very expensive gamble?
Well, to figure that out, let's look at this case study we found in the research about a guy named Elton.
Okay.
He was in one of the clinical trials, so he got the test for free, and he was so convinced by the results that he immediately turned around and paid the full $1,000 for his wife to get it.
And I love that anecdote because it really frames the logic. But I have to be the skeptic here for a second. I was looking at the data, and it says the test misses almost 60% of cancers.
It does. The overall sensitivity is about 40%.
I mean, if I paid $1,000 for a test that fails more than it succeeds, I'd be upset. So what did Elton see that I'm missing?
He was looking at the alternative. You have to remember, our current standard of care only screens for, what, 5 cancers?
Right. Breast, colorectal, cervical, lung, prostate. That's it.
So for the other 45 or so deadly cancers that Galeri looks for, think pancreatic, ovarian, stomach, our current detection rate isn't 40%.
It's zero.
It's zero. We don't look for them at all until you have symptoms.
So Elton's logic was a 40% chance is infinitely better than a 0% chance.
Exactly. He said we spend thousands on a colonoscopy just to look for one cancer. For less than that, you get a shot at finding 50 others years before you'd know otherwise.
That is a really powerful way to frame it. And the numbers get even better for the deadliest cancers, right? So I saw it jumps to like 74% detection for those.
It does. But there's another number here that's maybe even more important. It's what some researchers call the miracle stat.
Okay, what's that?
The false positive rate. It's only 0.4%.
Right, so break that down. Why is that the miracle?
Because the biggest fear with this kind of screening is that the test cries wolf. It sends you for months of invasive, painful, and expensive biopsies only to find out everything's fine.
The medical anxiety, the unnecessary procedures.
Yeah, but with this test, that almost never happens. There's virtually no downside in that respect. If the alarm goes off, there's a 99.6% chance there's actually a fire somewhere.
That makes sense. So who is this for then? I'm guessing Elton fits a certain profile.
He does. The research is pretty clear this is most effective in high-risk populations.
So people over 50, cancer survivors, or those with a family history.
Exactly. And also people with risk factors, like a high BMI.
Which, let's be honest, is a huge portion of the American population now.
It is. The tech itself is amazing. It finds tiny bits of cell-free DNA that tumors shed into your blood.
But we should probably pump the brakes just a little. I saw this is still a laboratory-developed test, an LDT. It doesn't have full FDA approval yet.
Correct. And you have people like Dr. Eric Topol, who's a leading voice on this stuff, urging caution.
What's his main concern?
He points out that for an average risk person, someone younger and healthy, the yield is pretty low. You might only detect cancer in 3 out of every 1,000 people tested.
So a bit like looking for a needle in a haystack for the general population.
For now, maybe. We're all waiting on the big NHS Galeri trial results from the UK, which should tell us if this actually reduces late-stage diagnoses and saves lives in the long run.
So at the end of the day, it's a personal calculation, isn't it? It's a $1,000 bet that might miss some things, but could find something deadly that all our standard tests would ignore completely.
That's a perfect summary. And of course, we have to say we're not medical professionals. We're just summarizing the research here.
Right. A disclaimer is always important.
But if you fall into one of those high-risk categories, a cancer survivor, strong family history, it seems like a conversation you definitely want to have with your doctor.
It absolutely does. And it leaves you with this final thought. If the technology exists to screen for 50 cancers with a single blood draw, how long will it take for the standard of care to finally catch up? Thanks for listening to this deep dive.
See you next time.